Hi guys, so today we are dealing with the next system, that is endocrine system. So we all know that, heard about that system, endocrine system. So what is endocrine system? What are the things which comes in endocrine system? So mainly we are focusing on the endocrine glands. So there will be so many glands which in endocrine system and the hormones in the endocrine system. Okay, so what is endocrine system? Endocrine system is nothing but that consists of glands secreting hormones essential for maintaining homeostasis throughout the body, that is endocrine system. And in endocrine system there will be glands that's like pituitary gland, thyroid, parathyroid, adrenal gland, and the testes, ovaries. So these all the glands which comes under endocrine system, and its hormones also. So that is the main thing which we are learning in the endocrine system. So what is next we are learning about the hormones. So what is hormones? So hormones are the chemical messengers that are secreted directly into the blood, which carries them to the organs and the tissues of the body to exert that function. That is hormone. Hormones means that the secreted directly into the blood. So into blood, which carries them to our organs, tissues, forward to maintaining the exert functions, their exert body functions. So that is hormone. So that is regarding the endocrine system and the hormones. Now we are learning about the functions, main functions of endocrine system. So what all are the functions of endocrine system? So main functions, it's like food metabolism, in growth and development, controlling the thirst and hunger, maintaining the body temperature, regulating mood and cognitive functions, initiating and maintaining the sexual development and their production. So these all are the main functions of endocrine system. Next, we are detailing of all the glands. So I told that what all the glands which comes under endocrine system. So next we are moving regarding all the glands. So okay, so topic is endocrine system. So our topic is endocrine system. In endocrine system, what are the the glands which comes under endocrine system. So we are learning about the glands and we are learning about the hormones. So this is our topic, today's topic, the glands and the hormones. In glands, what all the glands which comes under this endocrine system? So we are learning about it. So first we are learning about pituitary gland. Next we are learning about the thyroid gland. Next it is parathyroid. Next we are learning adrenal cortex. Adrenal cortex, and last it's come like ovaries and testes, and one more will be there, that will be pancreas. Okay, so these all are the glands which comes under endocrine system. So now we are moving to the first gland, that is pituitary gland. Okay, so what is pituitary gland? So pituitary gland, that is an endocrine gland of a size of a pea, that is the size of a pea, and weight, how much it will be weight? So weight nearly to the 0.5 grams and its diameter is 1 to 1.5 centimeter, and or else you can we can be said like 0.5 inches. Okay, so next, since the pituitary gland secrete the hormones which control what the other endocrine gland also. So this pituitary gland secrete the hormones which control other endocrine glands also. So that's why it got a name like master endocrine gland. So you know that master endocrine gland is pituitary gland. Okay, so next we are moving to the structure of pituitary gland. So how it look like and what are the parts which comes under pituitary gland. So it will be like mainly divided into two, that is anterior and posterior. So in anterior means that the larger side and the posterior is the smaller side. So in anterior again it has the three parts, that is pars distalis, PARS, pars. So pars distalis, pars tuberalis and pars intermedia. So these are the three parts which comes under anterior pituitary. So what is anterior pituitary? Anterior pituitary means 75% of total weight of the gland. So that is the largest one, and also it divided into three parts. So first one is pars distalis. So what is pars distalis? It consists of the largest portion and produces the hormones. So what are the hormones? Growth hormone, prolactin, thyroid stimulating hormone, adrenocorticotropic hormone, luteinizing hormone and follicle stimulating hormone. So these all are the hormones which produced by the pars distalis. Next one, pars tuberalis. So what is that? So it is a form of a sheath around the infundibulum and it secretes only the melanocyte stimulating hormone. So third one, pars intermedia. So what is pars intermedia? So it present between the pars distalis and pars tuberalis. So it is in between both. So it will be in the center of them. And this one fails to appear at the separate lobe in adults. So it will be fails to appear the separate lobes. Okay. Next one we are dealing about the posterior pituitary, that is the smaller one. Okay, so that is, it forms the posterior part of pituitary gland and consists of what? Pars nervosa and infundibulum. So it consists of two parts, that is pars nervosa and infundibulum. So that is about the posterior pituitary. And next we are moving to the hormones. What are the hormones that secreted in the pituitary gland? So that also divided like two sections. In anterior pituitary it is separate, and in posterior pituitary also it will be separate. So first we are dealing with the anterior pituitary. So what are the hormones? So main hormones which secrete in the anterior pituitary, that is growth hormone, that is GH, short form GH, and thyroid stimulating hormone TSH, adrenocorticotropic hormone, prolactin, gonadotropins. In gonadotropin again it is divided like follicle stimulating hormones and luteinizing hormone. Next, melanocyte stimulating hormone. So these all are the hormones which secreted in the anterior pituitary. So in sometimes there will be chance of asking questions like 2-mark questions or fill in the blanks like full form. TSH, what is TSH? Next, what is GH and what is ACTH? So we just want to know what is that. So GH, that is growth hormone. In growth hormone that stimulate the growth of the body cells. By hearing the name we know that growth hormone. So it helps in the growth of the cells, and also it affects in the metabolism of certain organs in the body, that is like liver, kidney, heart. So these all it will be helps in the metabolism, that is growth hormone GH. Next one, thyroid stimulating hormone TSH. So in this hormone it stimulates the growth and the activity of thyroid hormone, thyroid stimulating hormone. So it helps in the activity of thyroid. By hearing name we just want to connecting it. So thyroid stimulating hormone. So it will be secretion of thyroid hormone. So that will be T4 and T3. T4 that is thyroxine and T3 that is triiodothyroxine. So that are the hormones secreting in the thyroid. Okay. Next, adrenocorticotropic hormone, that is ACTH. Okay. This hormone influences the adrenal cortex and stimulate the hormone, that is what? Cortisol, that is a steroid hormone. Okay. So by hearing that adrenocorticotropic, so the hormones influence the adrenal cortex and releases the steroid hormone, that is cortisol. Okay. Next one, that is prolactin, PRL, prolactin. So this hormone is secreted during the pregnancy time, prolactin during the pregnancy time, and it helps in the stimulate the mammary gland. Why the mammary gland? To produce the milk. Okay, so that will be in the pregnancy time. Next we are moving to the gonadotropin. Gonadotropin, it is divided, it again have two, that is follicle stimulating and luteinizing hormone, FSH and LH. What is follicle stimulating? Follicle stimulating hormone is responsible for the production of gamete. Okay, and next one, luteinizing hormone. In luteinizing hormone, that production of gonadal hormone. So that is in luteinizing hormone. Next, what is that? Melanocyte stimulating hormone. In melanocyte stimulating hormone, this hormone protects the skin from ultraviolet rays and helps in the development of pigmentation and control of appetite. So melanocyte, we can hear that if the melanin is low, if the melanin is high, there will be chance of getting skin conditions and pigmentation. So we are hearing all that. So we can just apply here. Melanocyte protect the skin from ultraviolet rays, and it helps in the development of pigmentation and helps in appetite also. So that's all about that anterior pituitary hormone. So next we are moving to the posterior pituitary. So in posterior pituitary, again it will be like antidiuretic hormone or vasopressin. Okay. Next one is oxytocin. So these are the hormones. What is antidiuretic or the vasopressin? So this hormone is involved in the regulation. Vasopressin, we can diuretic, we can hear that the urine output. So it will be in the regulation of urine output. Next one, oxytocin. Oxytocin, what? It helps in the childbirth, pregnancy, and affect in the smooth muscles and muscle of lactating breast. So that is regarding the oxytocin. So our hormone section is over regarding this pituitary gland. Next, what are the main functions of pituitary gland? So these all functions, it comes in the next main function. So what are the functions? First one, it regulates the muscles and bone growth. It will be helping in muscle growth and bone growth. Next one, it stimulates the adrenal gland to secrete what? Cortisol, that is steroid. Okay, next one, it produces the estrogen in women and testosterone in male. Next one, it stimulates the thyroid gland to secrete the thyroid hormone, and it regulates what? Egg cell growth in women and sperm production in men. And the next one, it produces the milk in lactating woman, and it regulates the pain and brain's pleasure activity, pleasure center. Next, it conserve water and maintain the fluid, electrolyte imbalance, electrolyte balance, it will be maintained. So next, it contract the smooth muscle during the labor and the breast milk for the breast muscles for the milk production. So these all are the main functions of what? Pituitary gland. Next, we are moving to the next gland, that is thyroid gland. We know that where is thyroid gland, so it will be here in neck area. Okay. So next we are moving to the thyroid gland. Okay. So what is thyroid gland? Thyroid gland is the largest endocrine gland. It is like 5 into 3 centimeter, and weight it's like 25 gram in a healthy adult. Okay, and it will be brownish red in color, and that's about the thyroid gland, and it can be vascularized and receive 80 to 120 ml of blood per minute. In 1 minute, it can be received like 80 to 120 ml of blood. Next, what is the structure of thyroid gland? What are the parts and how it looks like? Okay, so thyroid gland lies on the anterior lateral side of cervical trachea, extending from where to where it will be. So extending from the level of 5th cervical vertebrae to the 1st thoracic vertebrae. So it will be length from there to here. Okay, and it comprises of 2 lobes, that is named as bilobe. It comprises of 2 lobes, so it is called as bilobe. Okay, and it is interconnected by a transverse glandular band, that is isthmus. Okay, and appearing as a butterfly. It will be looking like a butterfly shape, but it is actually a H shape. It can be called as H shape, and it will be in a butterfly appearing. Okay, so that's regarding the thyroid gland structure. And what are the hormones in thyroid gland? So main hormones in thyroid gland, we heard that thyroxine and thyrocalcitonin. So these two are the hormones producing in the thyroid gland. Okay. So next, what are the main functions? Functions of thyroid gland. Okay. So main functions like it control the body's metabolic activities. So main metabolic activity it will be controlling. Okay. Next one, what is the function? It secrete the hormones, hormone secretions which regulate the vital organ and maintain the internal homeostasis. It secrete the hormones and regulate the vital organs. So third one, it control the breathing and the heart rate it will be controlling. And fourth one, it monitor the body weight. It will be monitor, and it wings or lobe produce the thyroid hormone. It produces the thyroid hormone, and it secrete a hormone which control what? Internal body temperature and cholesterol level. So it will be controlling the internal body and cholesterol level. So that's regarding our thyroid gland. Okay, so next we are moving to the parathyroid gland. So parathyroid gland, that is also in thyroid gland. Okay. So what is parathyroid gland? Parathyroid gland are the small endocrine gland located in the neck. So it is the smaller one. Okay. It is, and the thyroid gland is the larger one and the parathyroid is the smaller one. And producing the parathyroid hormone. Okay, so it will be like, I can just show you the figure. Just I will draw a figure of thyroid gland. Okay, here I will be drawing thyroid gland. How it will be look like parathyroid. It's just a rough diagram. Okay, see, it is just a rough diagram. So you can see that this is thyroid gland. This is the thyroid gland. Okay, and this circle oval shape, that is parathyroid. Okay. Okay, so this one is thyroid and this one is circle or the oval shape, that is parathyroid. Okay, this is a rough diagram just to understanding. I just drawn it. Okay, so next I am just explaining it. It is a P-shaped and parathyroid glands are either completely or partially embedded in the dorsal surface, okay, of the thyroid gland. And each lobe of thyroid has two oval shape. Okay, this is oval shape. So two oval shaped, small sized and yellow colored. It will be in yellow colored, and the size it is like 5 to 5 millimeter. It will be in size. Okay, so this is a just oval shape. This is the parathyroid and it is the thyroid gland. Okay, so it will be like oval shape. Okay, so that's regarding this parathyroid. And what are the hormones in parathyroid? So parathyroid gland primarily secretes what? Parathermone, that is PTH, that is the, or else it will be named as Colip's hormone. Okay, so that is the hormone from parathyroid. Next, what are the main functions of parathyroid gland? So main functions include, it involved in the synthesis and release of parathyroid hormone required to maintain what? Body's calcium homeostasis. Okay, next one, it produces the parathermone, that is the hormone, and which allow what? Calcium to break down and to release into circulations. Okay, next one, parathermone control the calcium transported to cause calcium reabsorption. So it will be helps in the calcium production, calcium breakdown, calcium reabsorptions. Okay, so next one, it boosts the vitamin D productions. Okay, in our GI system. So these all are the main functions of parathyroid hormone. Okay. Next, we are dealing with the next hormone, that is adrenal cortex. So this is adrenal cortex. So next we are dealing with the adrenal cortex. Okay. So how the adrenal cortex and what is adrenal cortex look like? Okay. So adrenal gland. So adrenal gland, it is like indicating that it is a triangular shape. So okay, so these glands mainly regulate the stress response by producing what? Corticosteroids and catecholamines. So these all are the hormones which producing in these. Okay, so it is in the structure like it will be in a triangle. It will be in a triangle shape, and where the adrenal glands are located, adrenal glands are positioned on the anterior portion of the kidney. So it will be in the upper portion of the kidney, the adrenal glands are located. Okay, and it is divided mainly into two. So that is adrenal cortex and the adrenal medulla. Okay, so I'll just draw a diagram of adrenal gland. So first we are just drawing a kidney. Okay, here will be the adrenal gland. So this is adrenal gland and this is our kidney. And next we are drawing an adrenal gland. So it will be a triangle shape. Okay, and here there will be small portion. So this is a rough diagram of adrenal cortex. So what is this? This is our capsule. Okay, and center portion, that is our adrenal medulla, and the outer portion, that is our adrenal cortex. Okay, so this is a rough diagram of adrenal gland. So the outer portion, that is adrenal cortex, inner portion, that is medulla, and this layered portion, that is capsule. Okay, this is our medulla, adrenal medulla. Okay, so next we are moving with this in adrenal cortex. First one we are moving with the adrenal cortex, that is the outer surface. Okay. So, the adrenal cortex, this region is present on the outer surface and it is the larger one. Okay. So, in the adrenal cortex, there will be like distant zones will be there, each one secreting different hormones. Okay. So, first one zona glomerulus and second one zona fasciculata and third one zona reticularis. So, these all are the hormones. So, first one zona glomerulosa. First one, this is the outer zone. So, this is the outer zone lying just beneath the connective tissue capsule. Okay, it's just beneath the connective tissue capsule. Next one, zona fasciculata. So, this is the middle zone. First one the outer zone, second one is the middle zone. So, in this it will be arranged in a long and straight column. So, this is secreting the glucocorticoids. Okay. So, third one, that is zona reticularis. So, this is the inner one, the most inner side. So, this is the inner zone made up of cells arranging in like branching cord. So, this will be arranging in a branching cord. So, that's regarding the adrenal cortex. So, the outer surface. Next one is the inner surface, that is adrenal medulla. So, this region in present the center and is the small. We can see that by looking, this is in the center and that is the smaller one. Okay. So, that is the smaller one, that is adrenal medulla. Okay, next one we are moving to the hormones which comes under the adrenal gland. So, what are the main hormones which comes under adrenal gland? So, first one is glucocorticoids, mineralocorticoids, epinephrine, non-epinephrine. So, these all are the hormones. What is glucocorticoids? So, this is secreted by zona fasciculata. Okay, so this is secreted by zona fasciculata, and the hormones, which all are the hormones stimulating in here? So, gluconeogenesis, lipolysis and proteolysis. So, these all are the hormones in glucocorticoids. Next one, mineralocorticoids. In mineralocorticoids, it's secreted by which one? Zona glomerulosa. Okay, and here these hormones act on the excretion of sodium and the reabsorption of sodium and water and excretion of potassium and phosphate ion. So, here there will be the reabsorption of sodium ions and water and the excretion of potassium and phosphate. Okay. Third one, epinephrine. In epinephrine, it exerts the biological effect similar to a sympathetic nervous system. So, it will be exerted similar to the sympathetic nervous system. And fourth one, non-epinephrine. So, here almost same biological effect as a adrenaline. So, what all the things is adrenaline doing? So, here also the same biological effect. So, only one difference is there, that it operates during the normal stage and produces what? Lesser effect on cardiac activity. So, it provides a lesser activity, slowing down activity in the cardiac sections. Okay. And there will be greater constriction of blood vessel in the muscles. So, that is the only difference. Okay. Next, we are moving to the function. What are the functions of adrenal glands? So, first one, it allows the body to deal with stress related injuries, disease, work or the personal life. And second one, it determines the energy released and it provides the energy. Okay, so it determines the energy level. And third one, it secrete the hormones which allow the body to metabolize in resource to escape or fight of danger. So, here we can say an example, like if we are touching a fire or something, suddenly we will we will just change our hand from there. Okay, so that is the response from the adrenal gland. So, that is one example. Okay, so that's all regarding the adrenal gland. So, that is over. So, next we are moving to the next gland, that is pancreas. Okay. So, what is pancreas? Pancreas means, pancreas is a large gland located near to the duodenum and stomach. So, it is located near to the duodenum and the stomach. Okay. So, it lies where it is located. So, it lies obviously on the posterior abdominal wall. So, it will be the upper. So, posterior abdominal wall partially to the right and to the left of the median plane. So, there will be, it will be located. So, structure, how it look like? So, structure means pancreas is a retroperitoneal gland which is 12 to 15 centimeter long and 2.5 centimeter thick. So, it will be 12 to 15 centimeter long and 2.5 centimeter thick. So, it is present on the posterior of the greater curvature of the stomach, and it is divided into like head, neck, body and a tail. So, it will be 4 parts: head, neck, body and tail. So, it is divided like that. Okay. So, what are the main hormones in pancreas? So, main hormones like insulin and glucagon. Insulin, we know that how we are using the insulin, what the purpose, okay. So, it reduces the blood glucose level and blood glucose level. So, that is the main function of insulin. It reduces the blood glucose level, insulin. And glucagon, what is the function of glucagon? It increases the blood glucose level. So, that is the main hormones in pancreas, insulin and glucagon. Insulin means it reduces the blood glucose level. Glucagon means it increases the blood glucose level. Okay. So, what are the main functions? Functions of pancreas like digestion of protein. So, it helps in the digestion of protein, carbohydrates and fat. So, it will be helps in digestion of protein, digestion of carbohydrate and digestion of fat. Okay. So, next main one more function is that its endocrine part, the pancreas secreted this insulin and glucagon which control the blood glucose level. So, that is also one function. So, it controls the blood glucose level. Okay. So, that is regarding our pancreas. Next, we are moving to the next gland, that is ovary. Ovaries means we know that ovaries are the oval shaped paired organ present in either side of the uterus in the pelvis. Okay. So, it is located in the either side, both sides of the uterus it is located, and there will be primary female sex organs. It is a primary female sex organs and produces what? Female gamete, that is ovum. So, it will be producing the female gamete, ovum. Okay. So, each ovary is 2.4 centimeter long and it is positioned on each side of the lower abdomen. So, it is located in the each side of the lower abdomen and it is 2 to 4 centimeter long. Okay. So, next is structure of the ovary. So, structure of the ovary, the inner side of the ovary is covered by a thin epithelium which encloses the ovarian stroma. Okay. And next one, the stoma, this stoma is divided into two zones, okay, that is peripheral cortex and the inner medulla. So, that is the structure of ovary, okay. So, next we are moving to the each parts of it. So, first one is, one second. So, first one is germinal epithelium, tunica albuginea, ovarian cortex, ovarian medulla and ovarian follicles and mature follicle, corpus luteum. So, these all are the parts of this ovary. Okay. So, first one, germinal epithelium. Germinal epithelium, that is a simple epithelium. Okay, simple epithelium layer on the outer covering of the ovary. So, that is the outer covering of the ovary, just ovary shape, and that is outer covering of the germinal epithelium. Next one, tunica albuginea. So, this one is whitish capsule of the dense irregular connective tissue lies just beneath the germinal epithelium. So, it is just beneath the germinal epithelium. Okay. Next one is ovarian cortex. In ovarian cortex, this region is present just below the tunica albuginea and consists of what? Ovarian follicle surrounded by dense irregular connective tissue. Okay. So, next is ovarian medulla. So, here this lies below the ovarian cortex. So, it will be it is like one step. So, first one is germinal epithelia, tunical albuginea, ovarian cortex and next one is ovarian medulla. So, just below the ovarian cortex, and this medulla, this consists of what? More loosely connective tissue, more loosely arranged connective tissues. Okay. And connective tissues will be there, blood will be there and the nerves will be there and lymphatic vessels also there. Next one is ovarian follicles. What is ovarian follicle? These are found in the cortex. It is found in the cortex and this consists of oocytes in the various stage of development also. So, next one is mature follicle. So, this is the large fluid filled follicle which is ready to undergo for the ovulation. So, it helps in the ready for the ovulations. Okay. Next one is last, corpus luteum. What is corpus luteum? It is a fragment of mature follicle left behind after the ovulation. So it just after the ovulation it will be. Okay. So it produces what? Progesterone, estrogen, relaxin. So these all are the hormones it will be producing. Okay. So next, what are the hormones in the ovaries? So what are the hormones? Main hormones like estrogen, progesterone, relaxin, inhibitin and testosterone. So these all are the main hormones in our ovaries. Okay, so what are the main functions? Main functions of ovaries are: ovaries release the female gamete or ovum. So it will be releasing the female gamete or the ovum, it will be producing, releasing. So next one, they secrete the estrogen and progesterone. They secreting the hormones like estrogen and progesterone. Next, they also secrete inhibition which participate in feedback control of pituitary FSH production. Okay, follicle stimulating hormone, that is FSH production. So these are the main functions of ovaries. Okay, so that's regarding gland ovary. So next we are moving to the last gland, that is testis. Okay, the last gland, testis. So the testes are located outside the abdominal cavity. So it is located outside the abdominal cavity with a what? Punch called scrotum. So that is the testis, and it is deeply pigmented skin made up of fibrous and connective tissue, smooth muscles. So it is made up of what? Fibrous connective tissue and the smooth muscles. Okay, so that will be in a oval shape and is 4.5 centimeter in length and 2.5 centimeter in width and 3 centimeter thickness. So that will be its structure, that will be its size. So next we are moving to the structure of testis. What is the structure? So structure, it consists of three tissue layers. So that is tunica vaginalis and tunica albuginea and tunica vasculosa. So that is the main structure of testis. Okay, next, what are the hormones which produce in testis? So main hormone which produce in testis is testosterone. So that is the hormone which produce in the testis. Okay, and what are the main functions of testis? So main functions of testis, that is testis produce the sperm. So it will be producing the sperm, and what? It's producing the Leydig cells of testis secreting the testosterone. So that is the main function. What? It produces the sperm and producing the hormone, that is testosterone. So that is regarding our next the topic testis. So our main topics, main gland, that all over. So I just revised that what are the gland we just looked into it. So first one, pituitary gland, thyroid gland, parathyroid gland, adrenal cortex, pancreas, ovaries and testes. So these all are the glands which we studied, and from that the hormones which comes under. So many hormones also we just studied. So that's all about this endocrine system. So if anyone have any doubts, anything, means you can just comment below now. So I'll just wait for 2 to 3 minutes. So if anyone have any doubt, means you can just ask me now in comment section. Okay, so till now there is no comments. So I'm just winding up the class. Okay guys, so thank you.